when I came here for my interview, meeting all of the people, I could just tell that they truly loved their job and they loved teaching. And, you can, I feel like, just feel that sometimes when you're walking around and you're seeing how people are not only the way that they're taking care of patients, but also the way that they're interacting with their staff members and residents and that kind of stuff.
One of the beautiful things about our division is that we all trained at different places and then came here. So you see a lot of different styles within our group.
I love getting to walk a fellow through their first procedure. We practice it on the task trainers. We do simulations to prepare them, but there's nothing like being in the room and really taking over that procedure for the first time.
We are a fellow-run unit, we like to say. There's kind of graduated autonomy as you go through and show us what you know and how you practice. But the goal is always that our fellows are in charge of the unit.
We only have one fellow in the main critical care unit, and then one fellow in the intermediate care unit, and one fellow in the cardiac care unit at a time. And so they really get the unique experience of running the entire unit and being the touch point for all patient care that goes on.
So it's a lot to staff, but a lot of learning and a lot of kind of fun when you're the main fellow and the main focus and getting all kind of the attention and questions kind of thrown at you.
When I was looking at programs, I wanted, a large freestanding hospital that was going to expose me to everything from a clinical standpoint that I was going to be exposed to, and Bonheur checks both of those boxes.
The really amazing thing about practicing medicine here is we are the only children's hospital in this huge area, so we capture a large group of patients from very different backgrounds, and so I get to care for a very diverse patient population.
I think Memphis and the South in general puts us in a position to take care of very, very sick children because of the socioeconomic barriers to accessing health care that exist in our part of the country.
Not only caring for the patient and their disease, but also caring for their family.
You can't just do everything focused on the patient themselves, because that patient might be a 2-year-old, and so you truly have to involve all of their family and all of their caregivers as well.
Them being there, walking kind of like arm in arm with us, taking care of their child, our patient, is the best way to provide care for kids. Memphis has a lot of hidden gems. I think there's something for everyone here, from music, the music culture, the food culture, the just hardworking kind of blue collar culture of the city. I think it doesn't get the love that it should, and I think a lot of people move to Memphis and then they never leave because they end up seeing the greatness of our city.
And so I found it to be a really easy city to get to know. It has a good food scene, a good craft cocktail scene. I love all the green space. I have a dog, so we spend time running around at Overton Park.
There is a little bit something for everyone, and it's very much like if you love Memphis, it's going to love you back. And I think now, raising my child here, even if we ever leave this place, it's still a place that's going to be my home forever.
We talk a lot about the grit and grind feeling of the city, that it's hard to explain what that is. You have to actually feel it, but you feel it when you're here. People here in Memphis love Memphis. We love it here, and we want to see it do well. We want it to thrive, and you feel that when you're here, and it's just a big hug, almost a big family feeling.
The ideal fellow for us is somebody who is eager to learn and shows up every day just open to the experience. You don't have to necessarily be the most book smart or have the most research experience. It's about having the intellectual curiosity, that grit and determination to keep showing up and to keep trying, and staying open to feedback.
I want someone who loves what they do, who can really like nerd out about critical care, who is really eager to learn and realizes that like I am smart enough to do this, but there is so much more for me to learn, and to be open to the idea that I'm not done learning when I'm finished with fellowship. I'm going to continue to grow. Training here is really a fantastic experience. I think we train great clinicians who are kind, caring, who go on to be leaders. It's like this energy that you pick up on and you run with it as you go. And I want people to know that like there's a very important piece of training, and you get it here and you leave here, or some people stay here, and like you are great at what you do when you're done training here because of the experiences.